There's almost no evidence that employing physician associates in the NHS is safe or that they improve patient care. That's according to a new review from Oxford University.
I think they do have a role to play.
Despite more than 3,000 physician associates currently employed within the health service and plans by the government to increase that to a whopping 12,000 by 2036, researchers have found a significant gap in studies examining their roles. Speaking to BBC Radio 4's Today programme, Professor Tricia Greenhalgh, the lead author of the study, said this.
The research that's been done has focused on settings where these associates were seeing very low-risk patients under close supervision, so it's not really very surprising that there weren't any safety incidents identified. But that doesn't mean that these roles are safe. And in fact, to conclude that they're safe from the basis of the evidence we've got is an error of reasoning that is likely to cost lives.
But the government still has plans to greatly expand the use of physician associates and anaesthesia associates in the NHS.
We asked 18,000 doctors what their experience of these medical professionals were, and 87% of them said that they were witnessing practice that was putting patients at risk.
Here is more from Professor Greenhalgh.
If you're going to say that on the basis of studies of physician associates doing ward work, looking at minor injuries in the A&E department, working in general practice, on the basis of that, to say, oh, well, it's okay to substitute these associates for doctors on clinical rotas, it's okay for them to do complex procedures, it's okay for them to make independent decisions, then I think, yes, it will cost lives. And it already has done, actually. We've got coroner's reports, Regulation 28 reports, which are formal legal reports issued to prevent future deaths. And what they say is we need some major changes in the way that physician associates and anaesthetic associates are being deployed.
In a social media post, the British Medical Association had this to say on the report. This new research is a sad indictment of NHS bodies and the government, who collaborated in a headlong rush to expand the roles of physician and anaesthesia associates without first amassing the evidence that the role was safe. Last November, the government confirmed it was launching an independent review of physician and anaesthesia associate professions. The outcome of that review is expected in the next few weeks.
I think there is confusion about what these staff are doing, because not only are they being labelled as physicians or specialists, but they're clearly undertaking tasks that are inappropriate for their level of training.
A legal challenge against the doctors' regulator, the General Medical Council, over its regulation of physician associates, and specifically its refusal to set a scope of practice, has passed its first hurdle at the High Court, which has granted Anaesthetists United, an independent group of grassroots anaesthetists, permission to proceed to a judicial review, stating that their claim against the GMC raises serious issues of importance to healthcare professionals and patients. The legal case is aiming to achieve clear and enforceable guidance defining what physician associates and anaesthesia associates can and cannot do, and argues that the GMC has a statutory duty to set those standards.
I am taking these concerns seriously.
So seriously, in fact, that it turns out the Department of Health and Social Care is paying the GMC's litigation costs to defend the legal action brought by Anaesthetists United. Just think about that. Now, there's nothing wrong in the government funding the GMC to undertake the work required to introduce regulations for anaesthesia and physician associates. But if, as the Health Secretary says,
I am taking these concerns seriously,
how on earth can he justify using taxpayers' money to defend a legal action calling for nationally agreed guidance on what physician associates and anaesthesia associates can and cannot do? Surely national rules about what physician associates can and can't do, standard guidance on supervision, and an agreed process for patients to give consent should be given. After all, it goes to the very heart of patient safety. Anaesthetists United will be in court in May, so please do support them if you can. You'll find a link with this film.